Hello, listeners, and welcome to Anyone Can Move. This is your host, Caroline Gerhardt. I say it every single episode, but I don't know what else to say. I am so excited to talk to our special guest today. So, we talked a few weeks ago with Leslie Parrish about, injury prevention, pain management. She's a physical therapist, and so we learned a lot about that on that episode. And so, today we are talking with a professional dancer who has sustained a fairly serious injury and, is still dancing, is still working through it. We are speaking with Arianna Fleischman today. She is an art and flight team member, and she is a trainee with United Ballet Theater in Orlando. And so I'm so excited for you guys to hear what we talked about. She is just so eloquent and has such a great outlook. And I think as dancers, almost everybody has experienced some sort of injury before, whether it be mild or severe. And some of the things that we talk about, I think, are really important and need to be discussed. Again, we're on that same track of, things that people don't talk about. And I think this is definitely one of them. And so I'm so excited for everybody to listen. Without further ado, my conversation with Arianna Fleischman. Hello, listeners, and welcome to Anyone Can Move. I am so excited to introduce our special guest for today's episode, Miss Arianna Fleischman. Hello, Arianna. How are you?
I'm good. How are you?
I'm doing well. So, I'd love it if you just gave our listeners a little bit of background on you. Tell us about yourself and your history with dance.
For sure. I'm currently a trainee with United Ballet Theater, but I have danced with companies across the state, or not across the state. I'm so sorry. Across the country. I've danced at Milwaukee Ballet, Fort Wayne Ballet, and the St. Augustine Ballet, as well as attended summer intensives at Next Generation Ballet and Ballet Met. I'm a member of the Art and Flight team, and like I said, I'm currently dancing under United Ballet Theater in Orlando, Florida.
Very cool. And today we're going to talk a little bit about an injury that you had. Could you just give us a little bit of background on that?
Yes, so it's actually been a really complicated case because when I was started at Milwaukee Ballet when I was 18, um, I had just moved from home across the country, and I started having feeling a lot of pain in my hip, and I didn't know what it was. And I ended up waiting a couple months, which I don't recommend doing. And I went to see a doctor, and they diagnosed me with a labral tear. They didn't do any of the tests that they should have done or anything. They were just like, from the way your symptoms are presenting, I'm going to say it's a labral tear. We'll send you to physical therapy. So
Right.
I went to physical therapy for about two weeks, and then COVID happened. So the whole pandemic shut everything down, and I wasn't able to go to physical therapy. And I got an offer to go to be a trainee with Fort Wayne Ballet. So I again picked up everything, moved in the middle of a pandemic, and started dancing there. And I went to see another doctor there, and they actually did the test, and they said they saw a labral tear, but come to find out they actually didn't, and that they were just telling me that. And so I went to physical therapy for that, and that didn't work. So they were like, okay, we're going to have to do surgery. And I didn't really like that answer, and I thought that there was something else that I could do. And so after about a year of dancing on that, I decided to pack up and move to United Ballet Theater. I had auditioned and sent in videos, and they had accepted me as a trainee in their trainee program. And I really loved the whole mindset that they had behind injuries and everything. But I went to see doctors over the summer, and they actually diagnosed me with something other than a labral tear. So they actually said that I had an impingement of my iliopsoas in
Mm.
my hip and tendonitis in it as well. And my adductor also had tendonitis. I don't deny that there could possibly be a labral tear there that we're just not seeing.
Right.
But I did physical therapy while I was here. I started that about 2 weeks ago, and
Mhm.
they wanted to do a PRP treatment, which is a plasma rich platelet therapy. And what they do is they draw your blood, they spin it in a centrifuge to get all of the platelets and proteins and stuff out, and they inject that into the affected area, and it can take about 6 to 8 weeks to fully heal. but it's a very similar process, kind of a similar process to surgery, just not as invasive.
Right. And that's, something that some of our listeners who might not be athletes or dancers, it might be a little hard to understand, but like hearing you're injured is one of the worst things ever, especially hearing that you're having to have surgery or that is what the
Sure.
recommended treatment plan is, right?
Yeah.
And so having that option, I'm sure, was like mind blowing to you that, like,
Yeah.
well, this can heal and it's not going to be like 5 months off and
Yeah,
no
for
weight
sure.
bearing or anything.
I had actually done research on it before because I was curious if it might be an option when I was diagnosed with a labral tear, because I know that it's not super common for them to use it in hips. Right
Mhm.
now, it's really being used in mostly knees and elbows and injuries like that. But the doctors here are very progressive and they were like, well, I think it might help. So originally, when I was diagnosed with that, I wanted to try it, and they were saying that they didn't do it in hips yet. But
Goodness. Well, it's such a blessing too that you had doctors who were willing to, try that and like take that route and that option. And something that you said before, I mean, for anybody, no matter what walk of life you're in, not getting the information you need from a doctor is one of like the most frustrating things ever. And so I'm sure, especially our jobs is to use our body, like it's our instrument, it's everything we have. And so you're not getting the right information when you know something's wrong, like two incorrect diagnoses. What went through your head when you found out like
oh
it
my
wasn't
gosh,
right?
well, many things. I went through like a whole I was crying like every day because I was like, oh my gosh, I knew what was wrong and now I don't know what's wrong and I have to do all this research to learn what this is.
Wow.
And they said I'm kind of really a kind of a unicorn case. They
Yeah.
don't really for sure know what's wrong. They were just like, let's just treat mostly the symptoms that you're having and hope that the PRP therapy will heal it, because they actually injected it instead of in the tendon like they normally would for a case of tendonitis. They
Mhm.
decided to inject it into my actual hip, the actual joint. So I had that done last week. It's still definitely really sore, but
Yeah.
I might have pushed it a little bit, but I've been able to dance to a certain extent
Yeah.
in the past week, which has been really nice. But the first 3 days were really intense.
Yeah, I can only imagine then the pain that you were in. And something that our founder, actually James Boyd, talks about a lot is that he's endured injuries in his career. And he talks a lot about using every other part of your body except for the affected area. Like if your hip is injured, you're using your other leg, your other hip, all of your arms, your torso, your neck, your head, everything else, but just like let the hip chill. And that's something that I think is so different about dance. Primary, like regular quote unquote athletes, um, they're just told no, you have to stop moving, like stop going to practice,
Right.
stop playing games. But
Mhm.
dancers are always the ones to be like, well, I can still do it, I can
I
still figure
could
it out.
try, yeah.
Right.
I've been trying
Exactly.
to, it's been a very long time too. I think it's been almost 2 or 3 years that
Wow.
I've been dealing with this, and I've been doing full seasons on it and everything. It was just something that I just dealt with, and
That's
that's,
crazy.
yeah, that's not how you should deal with this for sure. I do not recommend that to anyone.
Yeah.
Like I said, I've been trying to get the treatment, but because I've moved around so much and finding different doctors that dealt with that and the
And
waiting
COVID,
time,
you know.
yeah, COVID shut everything down for so
Yeah.
long that it was really difficult.
So when you were going through these seasons, with how are you dealing with your pain management? Like,
I really, so at first I started taking a lot of ibuprofen. I took like 6 ibuprofen a day for like a good amount of time, and I'm not that tall. So that was a lot of ibuprofen for me, and they were like, well, let's not do that. That's not good on your liver. So they put me on one that is called meloxicam, and it's a bit of a stronger anti-inflammatory, but it's less of a dosage and it works a little bit different. So
mhm,
I've been taking that for a while, but really just trying to ice it, take care of it as much as I could. But I mean, even it's gotten to the point where, or it had gotten to the point where even everyday tasks were uncomfortable. Like I can't sit for long periods of time and I can't stand for long periods of time because it's just uncomfortable.
Oh my goodness. That is, you know, it's so heartbreaking to hear because I've dealt with injuries too, and I've, had people tell me different things, especially when like you get a diagnosis like overuse, and it's like, oh well, what do you mean? Like that
Yeah,
doesn't
like
mean
you're like, of course it's overuse. Like, what am I supposed to do about that?
right, exactly. But and I've done the same exact thing. I've gotten to the point where I've taken too many ibuprofens, and doctors
Yeah,
have told me the same thing. But it is really hard when you have this goal and you're trying to achieve it. And I think that's what people don't understand sometimes, is that the way our career works is so different. We don't get to perform well, depending on where you are or what you're being paid to do, you might not get to perform every single weekend. You might be like rehearsing for months and months to do this one big performance. And so
yeah,
when you're in a situation like that, it's like, I'm going to do whatever I have to do to get through that performance, because that's what I've been spending
right,
my last however many months preparing for. I'm
right.
sure you can relate to that for sure.
This one's been by far the hardest injury. Like I've had other injuries before. Like I had tendonitis in my left Achilles.
Hmm.
I've had really weak ankles since I was like really young because I have very hypermobile joints as well. So that really causes me to be more injury prone and really have to focus on strengthening a lot.
Right.
But um that's been like this has been like the hardest one that I've had to deal with, and honestly a lot of it is a mental game too. It's really hard mentally, especially you kind of go through like when you're in pain, it sounds really odd, but it can almost make you depressed in a way. Like
Yeah.
it just makes you sad and like you just feel like hopeless. But that's been a hard thing to, especially during the whole pandemic where I couldn't seek out the treatment I needed.
Right.
So really having a support system has been a really big thing with that too. Like my parents are very supportive. They've been helping me through this and everything. So
Yeah, that's something that I wanted to ask you about, was how did your how was your mental health affected by this, and did your outlook on dance, did it change from before and after your injury? I guess you're still
um,
technically going through it, but
yeah, 100%. It's taught me that, well, my mental health definitely has taken some swoops with it, especially because not being able to like fully dance, I want to work hard and I want to improve, but there's always something that was always holding me back with that. So I wasn't able to do that as much. So it definitely can spiral very quickly if you don't really focus on like what your general outcome is. And I mean, even now it's hard for me because I want to be able to do everything and I can't do everything because I have to understand, like I'm still healing
Mhm.
from it, and it's really difficult to comprehend that even though I'm been a professional. It's still hard for me mentally to comprehend. But that's been a big thing, and I think what was the second question? Can
Oh,
you
just
remind
how
me?
has your outlook changed on dance, like the way that you approach a rehearsal, approach a performance?
Yes.
Yeah.
Okay. Yeah, 100%. So I've really learned, you do work hard, obviously, but you need to work smarter, not necessarily harder. Like, you should do the combinations in class and rehearsals with intention as opposed to doing them multiple times.
Yeah.
Like, I used to be the person that would go with every group and do the combination like 3 or 4 times. And I think that's really how it affected me a lot. I mean, 1 or 2 times is definitely enough, but I think that you really have to focus on the intention behind what you're doing as well.
Right.
So
I
really thinking about those corrections while you're doing it, not just doing the combination and then thinking, oh well, I have all these 5,000 things I need to fix now. You
right.
really have to focus on the intention of it.
Yeah, and I think that brings up a great point, in that it is so hard for dancers to bounce back from injuries sometimes, because dance is notorious for kind of bringing along this idea of grind culture, that like you have to keep going, you have to be trying your like 1 trillion% on every single time you're doing it, and if you don't do it 1,000 times, then it's not worth it. And I think we are starting to make moves to change into more intentionality, more of a mindset kind of situation with the way that we rehearse and train and perform, which I think is such a huge step in dancers learning how to use pain management and injury prevention and how to recover from injuries, because it's perpetuated grind culture in dancers just going through injuries and like
100%.
yeah.
Yeah, and especially the company that I'm with now, United Ballet Theater, which is an affiliate of Art and Play as well. Um, they really focus on the dancer's well-being and they care a lot about that. We incorporate cross training into our schedule as opposed to having to do it outside of dance. So really trying to focus on preventing the overuse injuries that dancers get because we only have so many hours in the day. And if you're exercising outside of dance too much, it just makes it worse. It just gives you the overuse injuries that you don't want. So, and really focusing on working both in parallel and turned out because as dancers, and especially as a ballet dancer myself, we
Right.
work and turn out so much
Oh,
that we actually lose strength in the rotator muscles because we're focusing on those and not the internal rotation. So you really have to work a lot in parallel if you're dancing and turn out a lot, and vice versa.
yeah, for sure. And that brings me to another point that you touched on a little bit earlier, but um, was it difficult to communicate with doctors who might not know a lot about dance, who have probably only treated like football players, soccer players, that kind of thing before? And how did that affect your treatment plan, did you feel like?
100%. There's been a lot of doctors, luckily in Florida, there's a lot of dancers like the people that I'm seeing now currently work with Orlando Ballet that's here. So
Mhm.
they really know a lot about dancers, and a lot of people have been really good about getting me to people that do work with dancers,
Right.
especially like the physical therapists and stuff. Like my current physical therapist, she was a gymnast, so it's a little bit different, but it's definitely I've been able to translate some of the things into that, but it does affect it a lot because they don't understand that like you can't just take 3 weeks off. That's not an option. You have to still stay in shape and you still have to be able to work some.
Yeah.
And I mean, it's really difficult, but I think definitely clarifying your intentions and telling them and explaining, I don't have the option of
Right.
not doing this. Like, I don't have that option. I need a treatment that will allow me to be able to dance as soon as possible.
Right. And that, I think you worded it perfectly, like clarifying your intention with them, like making sure that they know it's not just because I want to like destroy my body that I can't take 3 weeks off. It's because I don't have an option. Like I
Right.
might not be the same dancer if I take 3 weeks off. That's something
100%.
that you were talking about turned out in parallel. Like those muscles that we use are so minute sometimes that if you're not training them every single day, you lose your strength in them, and it's gone. Like it's really hard to get it back and get that muscle memory back. But I think that is such a good point to make to anybody who's going through an injury, that like clarify your intention with your doctors, make sure that they understand, even maybe getting a like if you're younger, getting a dance teacher to come with you so they can explain, like somebody who might be able to articulate it better than you could, I think is so, so important. Um, so we've talked about how you are primarily a ballet dancer, and something that is so unique about ballet that I love is that it's such a rigid technique, but there's so much movement quality and artistry that you can add to it. Did you find a different that excuse me, did you see a difference in your movement quality or your artistry from before and after your injury?
Yes and no. It's definitely gotten my artistry has gotten better, I think,
Yeah.
but it also has made it a little bit harder to use it
Mhm.
because I'm not as stable as I used to be. Like in my positions, they don't feel stable, so I tend to use a little bit less artistry, but lately I've been really focusing on using more of it
Mhm.
because I'm like, if heaven forbid that my hip doesn't fully return to the way that it needs to be,
Yeah.
I need to have I need to have that extra artistry, extra port bras to kind of make up for that.
Right. I totally understand. And Ariana, if you don't mind me asking, how old are you?
I'm 20, so
Mhm.
I'm
Yeah.
still pretty young.
Yeah. And that is something and that's why I asked, because I figured you were around 20, and
Yeah.
it's so our career path can be so volatile, and the fact that
Yeah.
like we don't know what's going to happen. But I think you're out just hearing your outlook. You have such a great, you know, outlook on all of this and mindset towards it. And I personally think that your hip is going to get better and you're going to be great. But that is so important to like realize. I think sometimes we, especially if you grew up dancing from like a really young age, sometimes we take it for granted, and sometimes it's like, oh, I love this, but like I really want a day off, you know. And
Yeah.
I think understanding that like it could all change at any point and we don't know is something that helps keep gratitude centered for it. And I think that is just like a beautiful thing. Almost, it's like
Yeah.
I'm sure your love for dance has changed even throughout this experience. And
There's been a lot of honestly, there's been a lot of questioning. Like,
yeah,
I questioned for a good bit there. I was like, "Do I really wanna do this?" Like, because I love it to death, but sometimes it just feels so, like, hopeless, and then I get to dance again in a studio, and I'm like, "Oh my gosh," like, I can't believe that I was even thinking that
like,
because I just
oh,
adore
yeah,
it
that's
so
why.
yeah.
Yeah.
But it's also definitely been a learning curve in learning how to cross train too, because I'm actually certified in progressing ballet technique, which
Mm,
is a type of cross training for dancers that's specified around a lot of ballet movements, but
wow.
it doesn't put the same pressure on my joints as a typical ballet class would. So to stay in shape over the summer while I was waiting on diagnoses and treatment and everything, I kept in shape doing that and Pilates and things to take the pressure off of it.
Wow, that is really interesting. And I think that the fact that you now have that certification and you get to teach other people how to do that, that I'm sure has that been like so fulfilling for you?
It's been amazing. I
Yeah.
loved, and it's given me something to do over the summer because unfortunately I wasn't able to dance.
Right.
So, and like yes, working for Art and Flight is gratifying, and
Mhm.
it does take up some of part of my day. I needed something to take up like the other part of my day because I'm used to the 10 to 4 or 9 to 5 grind, and like giving yourself too much time to think about stuff can really send you down that spiral as well.
Right. And I think, we talked a little bit about mental health earlier. And for so many dancers, including myself, I use dance as my therapy sometimes. Like dance is
Yeah.
what I go to when everything else is too much, and it is the best release I ever have felt. And so when that is what you've grown up with, like using as your kind of therapy, for lack of a better term, you and then it's like you can't do it for a while, and it's like, oh my
Yeah.
gosh, there's all these thoughts in my mind. How do I, get them out?
Yeah.
Not like you can go for a run because that's not good for you either.
No.
So that is, I think, the fact that you were able to like pinpoint, okay, these are other things that I could do that will take my mind
Right.
off of it and still be productive. They're not going to be harmful. I think that is so beautiful. Speaking of that, um, I'd love to know if you have any advice for that you would give to dancers experiencing an injury.
Oh my gosh, there's so many. Don't overpush it.
Yeah.
Do not try to dance through the pain. It
Mhm.
is not good for you. I mean, like, soreness is different than pain, and you have to learn how to differentiate between those two things.
Right.
Um, get help. Get help as soon as you possibly can. And I understand that I'm lucky in the sense that I was able to go and see doctors and stuff like when I needed to. And a lot of people don't have the resources to do that. Do your research on the internet. Find ways to try and strengthen the other muscles that you know are weak. And if you know you're using the wrong muscles, retrain them, please,
Yeah.
because it's so hard.
Mhm. It is.
Um,
Yeah.
and you're not alone. Talk to, reach out to someone, your dance teachers, your friends, your coworkers, anyone.
Yeah.
Just really reach out and be candor about it, candid about it. Sorry.
No.
Um, really be open and honest about it. And I find that that helps to not perpetuate the stigma that it's shameful and that you're broken and that you're
Yeah.
not any good
Yeah.
to anyone.
That is, I think that like is perfect advice. Because it's so what you said at the end is so true. It can, when that's taken away from you for a while, it makes you feel like if you put your worth in dance, well, I can't dance. Like, what is my worth
Right.
now? And that's so it's so hard because it happens to everybody, and
Right.
everybody gets into that mindset sometimes, but it's not true. It's our worth is in more than dance. As much as we love dance and it is everything, like we have to find our worth in other places as
Exactly.
well.
And that's been something that I've definitely even had a hard time with. I've been dancing since I was 4 years old
Yeah,
and really training seriously since I was 8 years old. So
right.
I really like that's been most of my life. And I mean, like my mom definitely made sure, like growing up, that I had other things outside of dance, but
Mhm,
I just never fully took an interest into anything else other than that
right.
until recently because I realized, I have to have other things that I'm interested in.
Yeah. That's so sometimes from something as like awful as this is, and I'm
Mhm.
sure when it first happened, you were like, oh my gosh, this is like the worst thing that could have possibly happened. But
Yeah,
you've been able to find it's brought such beautiful opportunities out of it. And I'm sure that has felt like a little light at the end of the tunnel through that whole
yeah, for
process.
sure.
I'd love to know too. So this is kind of backtracking a little bit, but so this was an injury that happened over time. It wasn't something that like just you like went into a pirouette and
I
felt it.
I think so. I'm not completely sure because when I was 12, I actually was doing like a really difficult variation for my age, and I was doing like a ton of développés, which if anyone doesn't know what that is, it's where you just basically like bring your leg up and lift it as high as you can, and it was a pretty fast variation, and I actually like sprained, or I thought I sprained. I'm not sure that I sprained it, but the pain level and everything that I was having was consistent with the sprain. So I think that it could have been injured at that time, and then it I didn't have problems with it until I was till later, and then it showed back up again. So it potentially could have been something that happened, but as far as I'm aware, it was a gradual onset thing.
Right. Well, and I asked that question and bring that up because I feel like it's another thing that is is a misconception sometimes that
Mhm.
it has to be something that is like one singular occurrence and you heard something pop or you heard something snap and
Yeah.
that was your injury. And so I know it happens in other sports too, but I feel like, again, notoriously with dance, a lot of our injuries happen over time. They're gradual. It's not, and like you were
Mhm.
saying, it might be because some of our muscles are weaker than others and we need to
Right.
train them more. Um, but I know I've experienced, and I've had friends who've experienced too, going to a doctor with pain and then being like, well, what happened? And it's like, well, I don't know.
Don't know exactly. I 100% agree with that because, like, I've had to explain that. I'm like, I don't know what happened. It was a singular incident that I can remember. I mean, like in dance, you fall a lot.
Yeah,
To be completely honest with you, you fall a lot. Even professionals, we fall a lot.
right.
And you don't think anything of it. You're just like, get back up and finish the combination or whatever. And you don't really notice, like if you have pain or something unless something you hear something audibly snap or pop
Mhm.
or anything like that. And I think that those long set injuries, long time injuries are one of the hardest things to deal with too because you're like, you know, in a weird twisted sense of the way I kind of like at some points wish that it was something like that where it just had popped or snapped or something. So I knew that there was something wrong with it. And you even question your own pain sometimes. You're
Yeah.
like, am I really in pain or is this just like normal pain for anyone else?
Right, like soreness, yeah, and
Yeah,
it's so hard too because we put our bodies through so much that there are days where you wake up and it's like, "I cannot get out of my bed, I'm so sore."
yeah,
But then,
100%.
like you mentioned earlier, you said it's a learning process to figure out what the difference between, like, injury pain and soreness is,
Yeah,
especially because we're in a career path that starts so young that,
yeah,
a lot of other people don't experience, and so, especially when you're in like middle school and high school, trying to figure out like, am I just really sore or did I like do something wrong? It's
right.
definitely a learning curve, but it's an important one that needs to be talked about because I feel like it is one of those things that like everybody's like, oh yeah, we're sore all the time, but how do we differentiate that pain and how
Mhm.
do we know when we need to um, go
I
get.
also have the like really unfortunate part is I have a really, really high pain tolerance too. So to try to figure out like what the difference is has been a lot harder too.
Right. Yeah, that's a really good point. And then too, when you have that high of a pain tolerance, knowing that you were taking like 6 ibuprofen a day can only
Yeah,
give you an indication of how much pain you actually were
right.
in
A hundred
too.
percent.
That's an interesting point to bring up too, that like, when you go to the hospital or to the doctor and they say, what's your pain level on a scale of like 1 to 10? I feel like dancers always undershoot it. We're always like, it's a 3. And then
Yeah,
you
so
like do
I've had to
something.
like I've had to adjust my mindset to almost be like to think about what a normal person's pain level would be in
Right.
my like to figure that out. So I'm like, if I say it's a 3, it's probably actually like a 5. So I'll just say
Exactly.
it's a 5 because like that's probably about normal.
Always shoot for 2 over just to be safe.
Yeah, just to be safe.
Right. That's so funny. But it is true. It's something that we've talked a lot about on the podcast about, dancers are typically type A personalities, and
Hmm.
we are going to do what we need to do to get the job done, and nothing's going to get in our way. And so when you're experiencing physical pain with that mindset, it's so hard to be honest and say, no, my pain is actually at like an 8, and I do
Yeah,
need to maybe rest today, rest that part of my body today.
yeah.
Um, but I have just loved getting to hear from you. I'd love to know if there's anything else that, well, before I say that, I'm interested to know if before and after your injury, has your career goals changed? Have you thought about taking a different, not a different path other than dance, but like just a different path through dance?
Honestly, no.
Yeah.
It's just I know that it's something that I've wanted to do. Like when I was 8, I was like, this is what I want to do as a career. I
Yeah.
want to be a dancer. And that actually brings up another point is I think that overtraining at a young age is a huge problem right now too.
Yeah.
Because I started doing that every day
Mhm.
from the time I was 8 to now. And it's like I would be that person that's always doing extra stuff, like
Yeah.
always cross training and always doing extra like strengthening exercises and learning to take a day off has been really hard and
Yeah.
not feel guilty about it. And I mean, I know that that's like a logical thing, but it's definitely been difficult.
Right. It's so true. And like I look back sometimes too, and I look back on what my friends and I did. Like we days that we didn't have rehearsal, we were cross training and going to physical therapy appointments and physical training appointments and stuff like that. And so I think that's also something, it's a great point that you do bring up, because when people are like, oh, like take a day off, like it's okay. Your friends are like, hey, come out with us, like let's go get dinner. And it's like,
Yeah.
no, I can't. And it's not even that like I found myself sometimes in the position of I do have a night off, but if I go and do something with that, I feel guilty. I'm like, oh, well, it's a night off,
Yeah.
so I should rest. I should make sure my body's okay. And we,
Right.
get into that awful cycle of then, well, if you're not going and being social and you're just like resting in your house all the time, then like that isn't good for your mental health either.
No, it's not.
Yeah.
Then
And
you're
so
alone with your thoughts and then it just I'm
perpetuate.
definitely a type A personality as well. So I definitely have that where like I can't be alone with my thoughts for too long or it'll just go like downhill from there.
Yeah, no, and I think too that like the other point you brought up, that dancers nowadays are overtrained way too young. And I mean, some of the things that they can do are absolutely incredible and beautiful. But then I think about, is that kid really getting a chance to be a kid? And like, I
Right.
guess if that is what they want to do, like, that is their passion, go for it. But also, like, it does like breaks a little bit of my heart sometimes, because it's like,
Yeah.
be a kid,
Even as an adult, I have trouble doing that, honestly. Like
right.
I have trouble allowing myself socialize and do things outside of dance and I'm like I'm being lazy or I feel really guilty about it, but I'm like, you know what? Like naps are a great thing.
Right. Sleep
Like
is
do it when
good.
you have time.
Right, exactly. Yeah. Don't nap through rehearsal. That's not good.
No, don't do that.
No, but I think that something that at least has helped me in the past, is, like I go to school for dance. That's my major in college, and finding YouTube videos of dance professionals like doing like what I eat in a day, or like this a day in my life kind of thing. And you see that they're it's like at the end of the day, they like go out with their friends or like go to the movies or something. Like recognizing that people who do this like professionally like you do
Yeah.
do those things, I think is really important for people who are training and still on their way there to remember, because it, you are allowed to be a normal person, you're allowed to
Right.
be a human, even
My
though
favorite thing
like
to do at like night is I'll like do all my recovery. Like I have the compression recovery boots and stuff, and I'll like
right.
sit and watch TV and do that. And that's like my perfect night.
Right. You're like helping your body and doing something that,
Right.
you're going to enjoy. I love that. That's such a good mindset to have. Um, but I have just loved talking with you about this.
Well,
And
being
I'd
on
love
here.
to know if there's anything you would like to, tell our listeners where they can find you on social media. And if you have anything new and exciting coming up, like let them know
Yeah,
where they can find
for
you.
sure. So, you can find me on social media. My Instagram is at Ariana Ballerina one. There's an underscore before the one. Facebook Ariana Fleischman. I really have a really exciting season with United Ballet Theater coming up, and a really exciting season with Art and Flight coming up. We are doing a lot of amazing things with our enhancement programs and everything like that. Again, I'm a PBT certified teacher, so if you would like a class, just contact me. I'll do a discounted rate for you, especially via Zoom. I really do a lot of my work via Zoom because I'm so busy all the time.
Right.
Um, Other than that, I just please stay happy, healthy. Know that you're not alone in this fight.
I love that. Yes, I think that is like the greatest message that anybody could take from this episode. Just like
Yeah.
let people know when you're in pain and
Yeah.
you're not alone. Everybody goes through injuries. Well, Ariana, thank you so much for talking with me today. And I
Happy.
hope you have a great day. It was so good to talk to
Thank
you.
you. You too.
Bye bye.
Bye.
Oh my goodness. Well, I don't know about you all listeners, but I just feel so inspired after that conversation and just ready to like take on whatever dance throws at me next. And for those of you who aren't dancers listening or aren't movers, or well, you should be movers because anyone can move, but I'm sorry, I need to stop trying to be funny. But I hope that you all got something out of it and maybe understand a little bit more why dancers try and recover the way that we do, why we're so hesitant to take time off, why or you get very mad when we get injured, like anyone would, but I feel like we kind of take it to another extent sometimes. But I just loved speaking with Ariana, and I hope you all enjoyed listening to what we had to talk about. And as always, listeners, remember to keep moving, stay curious, and stay confident.